Go. Hi, my name is Ace Kiris, and this is my demonstration speech. For my demonstration, I'm going to be showing you how to use an EKG caliper to read an EKG strip. In my past speeches, I had mentioned that I worked at a hospital, but I've never told you my position. I'm an EKG technician / monitor technician. I basically watch people's heart rates. A normal heart rate is between 60 to 100. Anything above that might be a concern. Anything below that might be a concern. But either way, I try to make sure my patients are a normal sinus rhythm. Any changes in that rhythm, I inform the nurses and doctors to help them find out what's going on and help treat the patient. Whether it be digital or automatic, the manual caliper never fails. This caliper basically is like any other caliper, except it's tinier than the normal caliper used by architects, and more simple. An EKG strip records every minute for any changes, any abnormalities, or whether it stays the same, and that's my job to make sure it stays the same. So behind me we have a normal sinus rhythm strip, and as you can see, there are big boxes here, and within those boxes are small boxes. Now, for the sake of time, I will be demonstrating how to measure it using the R-wave method. Basically, I'll go to the tippy top of this R-wave right here to the next tippy top of this R-wave right here. And as you can obviously hear, these are the R-waves. So I would use the caliper. But this time I'm going to use chopsticks because it's too big. It's too big. I'll use this caliper to measure from this tippy top to this tippy top of the R wave. I don't know if you can see that, but there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 boxes. So let's do the math now. We always divide it by 1500 if we're going to use for the R-wave method, if we're going to count the small boxes. So 1500 divided by 20 is 75. So that's with a normal rate. 60 to 100 normal BPM for a patient. So 75, that's where we're at. Now I hope this video helps you. I hope this doesn't happen to anyone. Figure out what kind of rhythm you're at if you're admitted to the hospital. Thank you.